Okay, hi everyone. Thanks for joining us. We're live to chat about the flu jab. So I'm Faye. I work in Diabetes UK's research team, and I'm joined by Dan here. Dan is our head of care, and he's also a diabetes specialist nurse. Hi, Dan.
Hello, hi everyone.
So we've got your wisdom, Dan, for the next 30 minutes or so to answer everyone's questions about getting the flu jab. And I know we've already had some sent in, but please, as we're chatting and answering those earlier questions, do add any others that you might have in the comments below. We'll answer as much as we can as we're streaming live now, or any we don't quite manage to get through, we'll of course make sure we come back to you and get those answered. So we're here to talk about the flu jab, with the flu season just around the corner. And everyone with diabetes should have access to a free flu jab from the NHS. But we know people might have some concerns, or that things might look a little different this year because of the pandemic. So Dan, I'll dive straight into some of the questions we've had sent in. The first comes from Jason, and he said, last time I had the flu jab, I got really ill with flu anyway. Is this going to happen again?
Oh, Jason, if I had a magic ball, I'd be able to give you a better answer than what I'm going to. But yeah, we hear that quite a bit, that some people get the flu jab and then they still end up developing the flu. There's a couple of reasons why this can happen. The flu jab takes about 2 weeks to start working and to really protect you against the most common types, the most common strains of flu that we're expecting. So within those 2 weeks, if you come into contact with someone who has got flu, it's highly likely that you might contract the flu from them or pick it up from them. That's the first reason. The second thing is that there's many, many different types of flu strains that hit the UK during the flu season. Now, the flu vaccine accounts or takes into consideration what the most common, most likely severe strains of flu are going to be. So you may hear in the news people talk about letters and numbers. For example, H1N1 is a strain of flu that we know of from the past. There's various different strains. And so we can't protect against absolutely every single one, but we can protect against the most common ones. And that's what's in the flu jab. And that's why it's important to get it every year. We also know that from research that having the flu jab will just take the edge off the severity of other types of flus, but it won't completely protect you. So it's still really important to get it.
Great, thanks for that, Dan. Okay, we've got another question from Ahmed. So he's asked, the flu jab always makes my blood sugars go high. Do you have any advice that could help prevent that or bring them down again if they do?
Yeah, good question, Ahmed. Without knowing your particular type of diabetes or your treatment or anything, it's hard for us to really give accurate and individual medical advice. So I can give you a little bit of a general answer that hopefully answers this, but if it doesn't, write it again in the comments and we'll get back to you. So the flu jab itself shouldn't be putting up people's blood sugars significantly. So it shouldn't be causing a major problem. Whenever any kind of injection happens, whether that's a flu jab or a tattoo, any kind of injection, a foreign body is introduced to your body, then you will have an inflammatory response, which means your body will send through all these signals and messengers to see what's going on. And that will happen during the flu jab. And so when you get it in your arm, this inflammatory response will go to your arm, to the area that has been injected. And that inflammation, those inflammatory markers, will potentially cause your blood sugars to go up a little bit. That happens in people with diabetes and without diabetes. If you're finding that your blood sugars go up very high, they go up significantly higher, so either into the 13s, 15s, 16s, or even higher, then I think we need to look at what you're doing with your management around that time. It also can be a stress-related high blood sugar or stress-induced hyperglycemia. You might be particularly worried, stressed, or anxious about this. You might even do something different every single time, but your blood sugars go up. And a lot of the time in diabetes, as everyone with diabetes out there will know, is that sometimes we just don't know why it's happened. And the important thing to do whenever you have high blood sugars is to monitor. Make sure that you're testing your blood sugars. If you're told by your diabetes team to take corrective doses of insulin, then do that as per their instruction. But if it doesn't settle down, get in touch with your GP. If it doesn't settle down within 24 hours or so, get in touch with your GP because you might need a slight change in medication.
Great, and I suppose we do know, Dan, that the flu definitely does make your blood sugars go high. So there's that kind of balance to think about there. And that's the reason why, we really want to be getting the flu jab to avoid getting dangerously high blood sugars if we were to get ill.
Absolutely.
Okay, I'll move on to another question that we've had from Sarah. So she's asked, will the flu jab protect me against coronavirus because that's the type of flu? Or on the flip side, will it make me more susceptible to it?
Great question. That was from Sarah, was it?
Sarah, yeah.
That's a great question, Sarah. So flu is a type of coronavirus. Absolutely is. I think when you're using the word coronavirus, potentially you're talking about COVID-19, which is this one that's caused us all to be doing Facebook Lives on different formats and not seeing people and all these things. So the flu jab itself will protect you against the strains of flu that we know will be common during the flu season this year. And it is the best way of protecting yourself, alongside things of keeping well at winter. So washing your hands more regularly and keeping yourself warm, things like that. We don't know what it will do to the COVID-19 virus because it's a novel virus. We've never experienced it before, and that's why all of these things have been happening. So we really don't know how it's going to impact on COVID-19. We know that you will be very much protected against the common strains of flu that we will experience. But what it does to COVID-19, we kind of don't know. We know that it's not going to make you less likely to suffer experiences or anything like that. So it's still a very good idea to get this to protect yourself against the flu. We currently haven't got a vaccine for COVID-19, so we have to try as best we can to protect ourselves from flu, to stop us going into hospital, to stop us having problems with our diabetes, like they just mentioned, and having the complications from flu. But we kind of don't really know what it will do to our susceptibility of COVID-19.
Yeah, and I think this year I have type 1, and I think I'm going to feel more appreciative of getting the flu jab because there is a vaccine for it. So it kind of makes you look at it in a slightly different way. We're all, waiting so desperately for a COVID vaccine, and we have one for flu. So there's something there that can help protect us.
Absolutely. I think that we know that flu is very bad for people with diabetes. It can cause all of your hard work that you've done over the year to go through the window because it makes your blood sugars, it can make your blood sugars go dangerously high. You may need to go into hospital. And we know that we can do the best things to do to prevent that, which is have the flu jab, wash your hands. All the other stuff that we do to protect ourselves from COVID-19 will be really, really helpful as well. So it's not a case of having the flu jab and then that's it, you're fine, off you go, forget all the rules. That's protecting you against flu, and everything else that we're doing still needs to remain the same.
Great, thank you, Dan. Okay, we've had a question in from Mary. So she said that she called her surgery to ask for a flu jab and was told to wait for a letter before she could book in. So do you know if that's going to be the case for everyone, Dan, or does that depend maybe where you live?
I think that there's an element of it depends on where you live. So we're aware that there's a new cohort of people that will be receiving the free NHS flu jab this year, and that's the 50 to 64-year-olds who haven't had it previously for free. And that's in the preparation in order to protect the NHS from mass amounts of people going into hospital with flu. Because of that, we know that surgeries are having to roll out the flu jab in slightly different ways. Because of COVID-19, as with everything else, we've got to still protect ourselves and protect each other. So social distancing and PPE will be in place in your surgery or pharmacy or wherever you get your flu jab from. And because of that, we can't have too many, your surgery is unlikely to want too many people in the waiting room all at once. So what they may do is send a letter to say, now book in. If you are concerned, though, Mary, and if you think that this is going on too long and you haven't got in to get your flu jab, give them a call. If you're particularly worried, speak to your practice nurse or your GP to make sure that they A, have you on the list to get a letter in the first place, which I hope they have, and B, that if you're still not happy with that, to speak to them and try and find a resolution from that. Alternatively, you could call our helpline, and our number will be somewhere along these comment section. Call our helpline to talk to someone about how to get some more support when speaking to your GP.
Great, yeah. So we shouldn't feel as though we just have to sit back and wait for months. We can do something. We can ask people. Okay, I'm going to move on to a question from Ben. So he's asked, does the flu jab cover pneumonia also? I thought that was another jab, he said.
Yeah, good question, Ben. So pneumonia is a consequence. You can develop pneumonia, which is a fancy way of saying a particular type of very severe chest infection. You can develop that from flu. What I think you're talking about in terms of the other jab for it, excuse me, what I think you're talking about is the pneumococcal vaccine. Now, the pneumococcal vaccine is available to people with diabetes, and you usually only need one in your lifetime, unless you have kidney problems or some other hereditary problems. You only really need one in your lifetime. Now, the difference between pneumococcal vaccines and flu vaccines is that the flu is a virus, and pneumococcal is a type of bacteria that can spread and develop into certain things like pneumococcal pneumonia. So a bacterial pneumonia, it can cause meningitis and septicemia, which is a poisoning of the blood. So it's very important that we protect ourselves from that. But we only need one vaccine against pneumococcal through your lifetime, generally. The flu jab changes every year, depending on the types of strains that we know are coming, and it really only lasts for about a year. So it's important to get the flu vaccine every year.
Okay. That clears that up. Thank you. I got a text from my GP about 3 months ago actually to come and get a pneumonia vaccine. I didn't even know that existed actually. So yeah, it's worth checking whether you should have that and asking the questions, I suppose, if you don't think you have.
Yeah, absolutely. Then get in touch with your GP and get it. Like I said, you can get it throughout the whole lifespan of your life. So there isn't a particular program currently in the NHS that targets people to get the pneumococcal vaccine.
Okay, we've had a few questions kind of all about timing as well. So Jill, she said that she rang her surgery and was told to come back or contact them later in September. So is it safe for people to wait it out, Dan?
Yeah, generally towards the end of October and the start of November. And as I said, it takes 2 weeks for your flu jab to really start working. Now, lots of people get their flu jab right throughout the season and are fine with that. So some people will wait to December. Busy people who aren't able to find time will go at various different times. We've been asking for people with diabetes to start looking at that and start booking in from September. That way we know that the vast majority of us could get covered before the flu gets into the country. Having said that, because there's a lot of interest for people with and without diabetes to get the flu jab this year, there's had to be an increase in supplies. Now, in order to not waste the millions of flu vaccines that we've got into the country, they will be distributed and rolled out. You shouldn't be made to feel uncomfortable. So if you feel that having to wait a few days, maybe a week or so, makes you feel uncomfortable, then get in touch with your GP again and really talk through that. Generally, you can have the flu jab at any time through the season, but obviously it's not protecting you until you have it. So we want people to go throughout September and October in order to make sure that they are protected. And that really should be the case. The vast majority of people should be getting their flu jabs within that space of time. If you've been if you've been told to wait today until next week or so, there's low level amounts of flu in the country at the minute, so you are very low risk. And everything that we are doing to protect ourselves from COVID-19 will also protect ourselves from the flu virus. So keep on doing those, you should remain safe, and then get your flu jab as and when it's possible at your GP or your local pharmacy.
Great. And Calvin, who asked about when the flu jab will be available for high risk people with type 1, I hope Dan's answered your question there as well. So moving on to a comment from Ashley. She said, coming back to what we talked about right at the beginning, that she has had the flu jab 3 times and then has been very ill with the flu 3 times. Hasn't had it since and then hasn't had the flu since. So any idea what's going on there, Dan?
Very lucky, really. If you've been without having a flu jab, then yeah, you are very lucky and you're doing a really good job. So good on you. The flu jab is there's very few people that can't have the flu jab. There are some properties within the flu jab that some people might be allergic to, and that won't give you flu-like symptoms. That will cause pain and swelling more so than for a long period of time, and it can cause vomiting and headaches. Excuse me. So people who are allergic to the flu jab, there is other options available, and they are very small numbers. But if you speak to your GP or your practice nurse about your experience from past jabs, then they will be able to help you guide you onto the best one that's available for you. Because the flu jab changes every single year, though, if you go without it for 1 year, the different strains of flu that are in the country will need to be protected against from the flu jab. We know through lots of research right across the world that the flu jab is the best way of protecting yourself from catching seasonal flu. If you've done a great job like you have done of protecting yourself, then congratulations. But potentially, it's your decision as to whether you think that now is the time to kind of risk that. And if the flu jab means that you're best protected, then we'd advise you to still continue to go and get that. But speak to your practice nurse or GP about the slight variations that you can have that may make you less symptomatic or less unwell. Again, as we said at the start, though, you aren't instantly protected. So there's a 2-week period that you might pick up the flu, and that's just awful bad luck, though, really.
Yeah, absolutely. And in a kind of a similar area about the unwanted effects that the flu jab could potentially have, we've had David ask us about his daughter who has type 1 diabetes. She's 12 years old. So she had the flu jab 2 years ago and ended up constantly getting tonsillitis, David says. Before that, she hardly had anything apart from normal colds that kids get. So David's asking whether the flu jab lowers your immune system and whether there's any kind of different effects for children versus adults.
Good question, David. The simple answer is no, it doesn't lower your immune system. We have to remember that we are dealing with the seasonal flu. The flu season is around at a time where there's lots of other things that are going around. People are a little bit more unwell during winter because of the kind of things that we do during winter. So we don't go out as much. We don't go and sit in a park as much where we've got the fresh air, lots of space around us. We all huddle into the front room to wrap warm. So there's much more kind of viruses going on around us. In terms of tonsillitis is particularly common in the age group that you say that your daughter is in, the 10 and 12 years old. Think about where your daughter has been going to school, where there is more viruses going on, and children will be having particularly close contact. They're more likely to pick that up. And I'd often look at your daughter's diabetes control, because during winter, as we sometimes do a little bit less exercise, we sometimes eat a little bit more, bigger portions, try to keep warm, much more kind of comfort food, I think people would describe it as, can have an impact on our blood sugars. So as our blood sugars rise, if our blood sugars are high, then we are more at risk of picking up any kind of virus that is going around. So particularly during winter for your daughter, David, focus on the diabetes where the best that we possibly can, and try and keep your daughter as well protected from all viruses. We're not talking about wrapping up in cotton wool, obviously, but we do know that obviously children have more access to various different viruses, from going to grandma, granddad's house, going around to friends' houses, indoors at school all the time. So I think that that's probably more likely related to the throat infections that you say that she's been getting, rather than from the flu jab.
Thanks for clearing that up, Dan. And I'm aware that having lots of non-flu related questions coming through, so we will make sure we answer all your questions and comments, but we'll kind of stick to the flu ones for now while we're still live. So Lisa has asked, in light of the pandemic, are family members of people with diabetes also required to get a flu jab? She says she has diabetes and also a compromised immune system, so was on the shielding list.
Okay, I'll address the diabetes section first, if that's okay. So people with diabetes have been for a long time been deemed as high risk in terms of the flu risks. So people with diabetes have always been, for a long time, been entitled to a free NHS flu jab, and that continues this season. The cohort has been widened, so that a new cohort of people has been introduced, the 50 to 64-year-olds that I mentioned. And also I believe that healthcare workers have also been increased on their access to the flu jab. Now, if we think about you in your home setting with diabetes, if you are protected against the flu, the common strains of flu, and then your housemate, your partner, your child goes out and brings that common strain into the house, you are protected. There is I'm unsure if there's any plans by the NHS to ensure that household members will be given the same access to the free flu jab. The flu jab is available privately, so people can go to various outlets like high street pharmacies, your Tesco pharmacy, for example, and get a flu jab at a private cost. So if they're particularly concerned about that, they could do that. In terms of the free flu jab, I don't think that there is much call for that. Again, because people are bringing the infection towards you, but you're protected. As selfish as that sounds when I'm saying it out loud, we're very much wanting people with diabetes, because of the risk, to be protected. If someone in your house hasn't got diabetes and doesn't have any other long-term conditions, then the flu may not lead to any serious consequences. Having said that, it might. In terms of your immunocompromised condition, I'm not sure whether the shielding category people will be receiving a different level of care in terms of flu. So it might be that your household members get it, but we simply don't know at the minute, I'm afraid. I'd speak to your GP though. If there is major concerns, speak to your GP about that and see what they're doing in that local area as well.
Yeah, thanks for that question, Lisa. Okay, Wendy has asked how long the flu vaccine works for. She said she had hers in very late March.
Okay, so the flu vaccine, thank you, Wendy. Yeah, the flu vaccine it's advertised, it's told that it will last for the year. In reality, it will last about 9 months. It will be active in your system for about 9 months. That's a handy thing, because as you come to the end of that 9 months, we're very much in the low risk area of getting flu. If you had it in March, you would probably receive a vaccine for the flu season of 2019-2020. So it'll be a different type of strain that is on its way this season. So there would be nothing, no harms, no side effects, no consequences of you having the 2020-21 flu vaccine this year, this month, next month. You'll still have a little bit of the old vaccine working inside, but it'll be a slightly different vaccine. So it's okay to double up or to stack, I suppose you'd say, in diabetes.
Okay, I'll give everyone your 5-minute warning. We're probably going to start wrapping up about then. So if you've got any more questions, do please get them in now. So we've got one from Lynn. She has had the flu jab every year since she was diagnosed with diabetes in 2019. And then in 2019, she was ill with what was presumed flu. Is it worth it when the strains differ? Is it worth getting a flu jab when there's lots of different strains going on?
Yeah. Yes. Simple answer is yes, it is absolutely worth it. So the flu jab is developed to combat and to protect you against the most common, the most prevalent strains of flu that will be in our flu season. And we take this information from the Southern Hemisphere because they've just gone through their winter and starting to leave it now. So we know those strains that are on the way. And so the vaccine is developed for that. Every year it does change. So again, you're really unfortunate that you either picked it up while your vaccine wasn't working, those 2-week window, or you picked up a slightly rarer strain, which would still look the same. It's very difficult to know whether you got strain 1, 2, or 3 from your symptoms. So the chances are you might have picked up a rarer strain. If you hadn't have had the flu vaccine, you might have picked up the more common strain, or you might have picked up both strains and then been very, very unwell. I'm not saying that you weren't very unwell, but you might have been doubly unwell. So protecting ourselves against the most common strain is really, really vital. And it has an impact. It does take the edge off other strains, but it won't necessarily completely protect you. So absolutely, I would think that you should still go and get your flu jab this year.
Loud and clear there, Dan. And then another Lynn, different spelling, has asked, how often do we need to get the pneumonia vaccine?
So the pneumococcal vaccine is for the majority of people once in your lifetime to protect yourself against pneumococcal bacteria infections such as pneumococcal pneumonia, pneumococcal septicemia, and pneumococcal meningitis. Again, like I said earlier, there isn't a national program that I'm aware of that focuses on screening or targeting. So it's just about speaking to your health professionals and your health professional team to say, have you had it? And it's okay to double up on that. So if you've had it, but it's not documented or you can't remember and you get it again, it's okay. Some people with kidney disease and some heart conditions, very slightly rare heart conditions, might need to have it a little bit more frequently, and usually about every 5 years. But again, for the vast majority of people with diabetes, once in your lifetime.
Brilliant. Okay, so Pamela's commented that she's concerned as she had anaphylactic shock several years ago from the flu vaccine. She's asked if there's an alternative as she's type 2 and has had a heart attack and triple heart bypass.
Right, yeah, Pamela. Yeah, anything that causes you to have anaphylaxis reaction, we need to avoid, absolutely. As I said earlier, there's very few people who will have a problem with the flu vaccine, but you, thankfully, here with us now, are one of these few people. There is alternatives, yeah, there can be alternatives, and it just means that it won't be the stock supply flu vaccine that is in your GP or your diabetes centre's fridge. So they will just have to order different ones in. We won't want to give you anything that will cause you to be incredibly unwell, which is anaphylaxis. So yes, there is alternatives. Speak to your GP. Continue to do the usual stuff. The usual stuff of protecting ourselves from viruses is the washing of our hands, which with this 2020 is like we're all perfect at washing our hands now. But everything we're doing to prevent COVID as well will also reduce your risk of flu. So keep up doing those, Pamela, and speak to your GP. Still definitely worth it just to investigate whether there is an option for you.
Certainly. And Christine, she's said that she was shielding on her GP's advice, and she received a text in early August to make an appointment for the flu jab, and she's been given an appointment for the 3rd of October. Should she have it earlier?
I think from the 3rd of October, I would be, if you were me, my sister, my mother, I would be comfortable with you going in October. Again, the flu season doesn't really hit until the end of October, the start of November. So I think that you would very likely be covered by the time flu gets here. So yeah, I think that you will be safe. If you don't feel comfortable with that, though, if you don't feel that that's right for you, get to your GP, speak to your GP and say, you know, you've had this, you were shielding, you're particularly concerned about flu and want to be protected. They might be able to bring you in a little bit sooner. But I hope it doesn't cause you any unnecessary concern, because I don't think there really is a reason to be concerned if you're getting it in the 3rd of October. If you are particularly stressed or worried or concerned, then get in touch with our helpline to talk things through. That's absolutely what we are here for to do as well.
Yeah, and we should have the details of the helpline in the post underneath this video. So we're going to have to start wrapping up there, but before we dash, Dan, is there anything else you'd like to cover or let us know?
I just think it's really important that we are aware that we can get our flu jabs from various different places this year. The NHS will be putting out some more communications around where, when, and how to go and get your flu jab. But because of social distancing, it is going to look slightly different. Reach out to your high street pharmacy. We're aware that Boots and Tesco Pharmacy have got appointments online that you can go in and book into. Speak to your pharmacist. Your pharmacist is a great person to chat to about your concerns regarding flu vaccines. So speak to them also. But be aware, it's not just from your GP. You can even get it from your diabetes team. So if you've got a diabetes annual review in person coming up, it might be a good opportunity to get in touch with them and say you'd like your free flu jab whilst you're still there. And that might be something that they do. It might not be, but it's worth asking and getting that out. It's really important. It's one of your 15 healthcare essentials. So, you know, you are entitled to it. So do push for it. And we'll all hopefully stay well this week.
Thank you, Dan. That's all been incredibly helpful. Thank you to everyone who's been listening in and sending questions. We will make sure we get back to everyone. And yeah, just a reminder that our helpline is there for you. It's 0345 123 2399. If anything comes up over the next few weeks as we go into flu season, don't hesitate to get in touch with us. There's also our forum there where you can get support, and the learning zone on our website. So please do reach out to us. And we'll leave it there for now. Thank you, everyone. Bye for now.
See you. Bye.